Is your skin aging faster than it should, despite all the creams, the serums, and your great routines? Well, it actually may not be your skincare that's the problem. It actually may be something called inflammaging. Today, I'm diving into one of the most important yet misunderstood topics in skin health right now. And that's this concept of how chronic low grade inflammation can silently speed up aging and what you can do to stop it. I'm Dr. Alice Mina. I'm a board certified dermatologist and host of the Skin Real podcast, where I love to give real people real information about their skin health so they can make informed decisions. In this week's episode, I sit down with Dr. Orie Achonwa, a dermatology researcher and wellness expert with nearly 2 decades of experience helping high performance individuals protect their health from the inside out. I love this concept of skin health being whole body health, and we're talking cortisol, collagen, chronic stress, and the gut skin brain connection. And most importantly, the real lifestyle shifts that actually work. So if you're tired of quick fixes and ready to understand how your habits, good and bad, are showing up on your skin, this conversation is a must. Let's get into it. Dr. Ori, I am so excited to have you on to talk about something that is just getting a lot of buzz recently. And I have to tell you, as someone who is in her mid 40s, I am super interested in inflammaging. So thank you so much for being here.
Thank you so much for having me. This is a very exciting topic to talk about.
Absolutely. So let's just start off for a lot of people. I bet they've never even heard this term, right? It's like a combination of inflammation and aging. And now we're putting it together called inflammaging. What is it?
Yeah, so it's exactly as you explained it. And what we're finding in research is that as we age, we accumulate more inflammation. And as we're accumulating more of that inflammation, it has an impact internally, which we can see on the skin because inflammation has certain effects like damaging proteins. And we know that we need structural proteins in our skin that gives us our bounce back. But when you have that chronic long term inflammation that's slow and under the radar, you start to see little signs like fine lines, a little bit of sagging in our weaker skin area, like under the eye or in our neck. And that's all the effects of inflammation.
Yeah, I feel like that word is such a buzzword nowadays, right? Like almost is being used maybe too broadly. In some aspects, everyone talks about like, you're inflamed, I'm inflamed, right? But there is actual validity and truth to the matter of inflammation can cause these downstream effects, right?
Yeah, so it becomes one of these phenomenons that when we are looking for answers, why am I aging a little faster than I would like? Why am I seeing these signs? I have this beautiful skincare regimen. I'm getting all the best of the best, but still I can't get my skin to glow or look the way that I want it to. So we start looking for explanations, and whenever science starts to hint that okay, we could have an explanation for something different, we kind of grab onto it and we like, yes, it must be that. That is the answer. But inflammation actually does have scientific underpinnings. Research is showing that there are certain pathways for inflammation, IL-6, TNF alpha, that progress over time. And they also are similar pathways that we see in psoriasis, eczema, atopic dermatitis, and premature aging. So that's what science is starting to put together and trying to use as okay, this can be something else that we need to work on complementary to the other protocols that we have for some of the conditions that we see our patients come in with.
Yeah, and I think so important nowadays because we've gotten so good at curing these things that kill us acutely. But now the big issue are these chronic medical conditions, right? Or these chronic conditions that we can't cure, but people are living with for very long times, especially now as our lifespan of people is increasing, right? So you mentioned like psoriasis. We know that is definitely pro-inflammatory, right, in the skin and in the body, right? Not just in the skin.
And something else to add to that is, in addition to us living longer, so now we can see chronic disease that's more on our radar, we also live more complex lifestyles than we did even 20 years ago. We're always on, thanks to technology and our interconnected lives. Absolutely, we can't stay away from them. We're always on. We're multitasking. We've accelerated the pace of living, so we're doing more. So we're not resting. Okay, all of these lifestyle factors is also aging us as well too. So we're starting to see effects of inflammaging at younger ages than you would expect, given a lifestyle that was at a slower pace maybe 20, 25 years ago.
Yeah, it's like we have all this technology which is supposed to make our lives easier and make things simpler. But I feel like all it's doing is making us do more, right? Like now we're just doing juggling 20 things instead of 10, right? Because it's so easy. But yeah, I mean, you hit the nail on the head. Like I even will have time where if I'm not doing something, I feel like, oh, I'm wasting my time or I'm not being productive. Like I have to actively fight that feeling that if I'm not go, 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 then I'm being lazy. I'm not being efficient. So, yeah, it's a struggle for sure. And yeah, I think when we talk about inflammation, we talk about wellness, I don't think enough emphasis is given to our lifestyle and things like putting up boundaries on phone use or technology use, right? Like I do feel like that plays a huge role. And I know we're veering off of skin just a little bit, but I mean, talk about a huge promoter of stress and inflammation.
Right, right. Actually, we're not veering off of skin, and that's really the interesting part because it's not related to applying a product. We don't always see the connection between our habits from the foods, from, as you're saying, being constantly in a go mode. Okay, those are sending off signals in your body, and your body is responding to it. Skin is a bi-directional organ. It's responding to your internal environment and also the external environment as well too. So the way that we're living is greatly affecting our skin as well. So it is very connected.
Thank you for bringing that up because I think sometimes people think their skin is just the face, right? Like maybe they include the neck and décolletage, but really it's like your face. But you said it like our skin is an organ. It's an organ system just like your nervous system, your circulatory system, all these things. So and the skin isn't just, in isolation, right? And I say the skin doesn't just react, it reflects. It reflects how we're taking care internally. And I know as a dermatologist, like I've seen conditions on people where I can tell there's something internal going on just by the skin findings, which is so cool. It's like being a detective. You're like, wait a minute, this kind of skin and someone in their 20s, this doesn't, something's going on with your elastic fibers and, boom, they have this condition. So I think we definitely don't put enough emphasis on that. I think with skincare, everyone's just talking about like, what do I put on my skin, like physically applying. And so I love that you brought up that our habits make a difference.
Yeah, and I think that there's starting to be a little bit of the paradigm change, if you will, of understanding skin as not just an organ by itself, but as a brain, hormone, gut, immune, skin axis that all interplays with each other. At one point in time in embryology, skin and immune system came from one layer and then evolved to be separate. But I think that we're really starting to understand that how we eat affects the gut and how healthy our gut is at any point in time will affect the immune system. If your body is, you're taking in all your necessary nutrients, but your digestion system is not eliminating properly, your body has to push out waste one way or the other. So it's not through your gut system, it's going to push out through your skin as the blemishes and the flare ups that you see. So we're now starting to think in that interconnected way with skin, and that's really exciting for some of the new approaches that we're going to be able to try with patients, especially the ones who have the chronic conditions, and also as answers to our approach to this whole anti aging that we like to chase, not just going to topicals products, but also what can we do in our lifestyle? How can we change our diet, our sleep habits, little things like that? Because with poor sleep, cortisol increases. When cortisol increases, it affects the skin barrier. When that breaks down, more transepidermal water loss. Okay, we know no hydration. That means fine lines and wrinkles. So you can get the best products. But if you don't treat, taking it all the way back to your sleep habits, then you're going to continue seeing that. So as we start to now push for, I don't want a band-aid approach, get to the root cause and address it there. And that's, I believe, where the public mindset is right now. I think we're going to continue seeing more emphasis on what else beside the skin or interconnected with the skin can we look at.
Absolutely. Yeah. Definitely cortisol, right? Like that's a big one people are talking about, right? A layman's term is adrenal fatigue, right? And this idea that our bodies have just all this high levels of cortisol circulating that because we're in this sort of like fight, flight, or freeze mentality, right? Even though there's really not a tiger we're running from. We don't need to be living like that. But yeah, 100% it shows up in your skin. And yes, sleep so important. I feel like it took me until I was 40 to be like, maybe I do need to focus on my habits. So I'm a slow learner, evidently.
But you got there. So that's all I'm looking at.
It's a work in progress, but, in as you know, in medical school, right, like, we were taught, like, to tell patients to do this, and then we're sort of expected to not sleep, to not eat, to not do any of these things, so we've been sort of indoctrinated, like, "Well, tell people to do those things, but you don't need to do it. You need to, be up all night and grind." But, yeah, I do hope we see the pendulum start to swing the other way of, "Okay, and it's free, right? Like, we're not asking people to go buy expensive things and all these supplements and all that, like, we're just saying sleep and maybe focus on whole food, right? That looks like the vegetable or fruit it says. If it says strawberry, make sure it looks like a strawberry, right? And not flavored. So that plays a huge role. I know I didn't realize about the whole concept of advanced glycation end products for a long, long time, and how can you kind of speak to that a little bit with inflammaging?
That's a really interesting topic because I'll be honest, when we talk about medical school training and we learned our biochemistry, our pathophysiology, I always just associated glycation with diabetes. And that's as far as it went for me. And approaching that topic, if someone didn't have diabetes, I really didn't really think about their blood sugar, especially coming from my wellness background before medical school. But, glycation, yeah, there's lots of research showing that there is a link between glycation and pro-aging, accelerated aging, because of the way that it affects the proteins in the skin. So we all, regardless of whether we have been declared to be in a diabetic range, we all have to watch our blood sugar spikes. Maybe you're not watching your hemoglobin A1C every 3 months, but your everyday blood sugar spikes, and you're not always going to feel it the same way someone who has to be concerned about their blood sugar would. You might feel it more so midday. You need your little sugar snack, or after you eat, you feel like you need a snack. That's a sign that your blood sugar is not balanced. And how do you solve it? Okay, we think, okay, eat less sugar, but it's sugar's not always a candy bar. It can be pasta, it can be your bagel. There's many different sources of sugar, even fruits. Some fruits have more sugar than others. If you want a lower sugar fruit, have the berries. And people are like, wait, hold a minute. I thought I was supposed to eat bananas for the potassium. Okay, but a banana at a certain stage of ripeness, so look at the color of the banana, would be have less sugar glycemic load than a different banana. So those are some of the new learnings that we will have to acclimate ourselves to as we start approaching skin from this more holistic perspective. And that's how glycation has just been a topic in one domain, the endocrine, the diabetes, but it's really a topic for all of us. The blood sugar control it. And how do you control it? We think, do I need meds? Do I need, how, just start with adding more protein to your meals to balance it out. Let's start there. And for some people, that can do a world of difference. But we're not getting a whole lot of education right now about balancing our meals properly, especially as we go through our different cycles of life and maybe our metabolism and digestion changes. How does that need to change for you, especially when you're using it in a preventative measure for skin health and overall wellness?
So true, and yeah, I think a lot of people and I'm included, right? Like, I was like, "Well, I don't have diabetes, I don't have to worry about that. I can eat whatever I want, and I can eat whatever sugar I want," and then boom, 40 happened. I was like, nope." I was on this trajectory to gain 10 pounds a decade, which you may say, "Oh, 10 pounds, that's nothing," right? But then that's 20 pounds, and then 30 pounds, and 40 pounds, etcetera. And that's how you end up, 70 and having a hard time getting around and mobility and things like that. So yeah, I think it is important that really no matter your weight, no matter your size, your age, like these are things to think about and not just for people pre-diabetic or diabetic.
Yeah, yeah. Just a slight change in education that's we will have to get used to.
Yeah. Well, you've got such an interesting background. Can you talk a little bit more? You were trained in wellness, right? And worked in that field and now pivoted to medicine, which as I'm sure you've heard, like there's criticism about the medical education and training that it's not holistic, that it's very problem focused. And I think it has been that way because for 100 plus years, that's what we were trying to fix, right? But now really medical education needs to change and evolve as we have these more chronic conditions that we're dealing with now.
Yeah, and as you know, our understanding of human condition, disease, chronic disease management, that's always evolving. And I think that medicine's really good about staying open to, do we really know everything the way that we think that we should? But coming from someone, I didn't go straight to medical school as most doctors did. I actually started off in wellness. So I was a wellness coach for probably, oh goodness, over 10 years, I think about 11 years or so. I was a wellness coach, and we use non medical approaches to help people manage fatty liver disease, diabetes, heart conditions. And at some point in time, I actually don't remember how this transition happened, but I ended up being a holistic health coach to high performance individuals, celebrities, corporate elite, and a diplomat.
Wow.
So working with that particular set of people, it's a little bit different. Access is different. That's kind of how I got into it. Access is different. So there's all of this new research. Research, unfortunately, takes a while before it goes into practice for everyone. But these groups, because of their access and their resources, are able to put people like myself on their team who bring that science into practice for them way before anybody else gets it. So that's why you look on TV and you see your favorite person and they don't age a bit because they have these advanced systems that they can build teams and put people like me on them and pay us a lot of money to make sure that they have it ahead of time. That was my intro or my beginning in the health and medicine world. And I did that for 10, 12 years and also got a doctorate in that time period. But then I started getting interested in the pathophysiology, the mechanisms behind the conditions, what we see. Went into research for a while and then for some reason bit the bug and went to medical school too. And so I was able to see non-medical approaches and also be trained in traditional medicine, allopathic care. So for me, I always have a hard time seeing a separation between the two. I see them as complementary. I walk into that. Sometimes I have peers who, especially the integrative dermatology that's becoming an emerging paradigm, and they're like, "What do you mean that the environment or the immune system can affect skin?" I'm like, "Well, you see a patient with a rash, and because of my background, I'm looking at the rash and I'm considering, okay, is it a reaction to maybe something environmental? Or could it be part of the immune system? So that takes you with a differential of atopic dermatitis or all the way up to T cell lymphoma. Nothing's ever what it seems. So I really see that more of medicine is becoming open to, okay, if we can get proof, evident scientific proof, we are wanting to consider what else do we need to know about conditions that can help us better manage patients. So it's never really been that allopathic medicine pushes away complementary or doesn't want to do holistic. It's just that it has to be evidence-based, and I think that's what's really good about our medical system is that we're gonna scrutinize it clinical tested before we say, okay, we can consider this next to treatments and pharmaceuticals that we know for sure through the rigorous RCT trials do work. So I think it's evolving. And of course, the next generation of physicians, they're also, I'm always surprised when especially when I go to conferences, when I meet other doctors and the backgrounds that they come from. At the Integrative Dermatology Symposium, I met another doctor and his training was in acupuncture and then he became a physician. So he blends the two in his practice. And I just think that's really amazing.
Yeah. And you know, it's so funny. I just met a doctor who is an anesthesiologist who now is trained in acupuncture and she does pain management. And she wanted to be able to offer her patients alternatives to things like narcotics, right? And how does behavioral therapy and mindset work and stress management and acupuncture, like how do these all play a role in pain management beyond just here, take this pill, right?
Exactly. Absolutely.
Yeah, I think we are, this is the future. And I'm hopeful with AI and perhaps we can get sort of the data from clinical trials faster. Maybe we can sort of accelerate that because, yes, that is one of the big holdups with medical research, right? Like we want it to be evidence based, randomized controlled trials take time, they take money. And so we don't always have that data. But if hopefully in the future, maybe AI can speed this kind of stuff up so that we can be able to innovate and make recommendations faster to really help people.
Absolutely. It's an exciting time and I'm hopeful for the changes to come.
Yeah. Now, what about, so we've talked about kind of habit, diet, sleep, stress management, right? Like all of these are like the foundation, right? Of health, not just skin health, right? But a healthy body, a healthy life, right? What about medications, right? Because is there a role for medications in helping with inflammation? And where do you see that fall?
Well, there's always a role for medications. I don't think that we're going to get to a time or should even think of a time where we say no to pharmaceuticals. Our current problem is how much we take, how long we take it. So when we're thinking about all of these complementary approaches, it's exactly that complementary to work along with. What we are thinking, just think about inflammation for one in certain conditions, psoriasis, atopic dermatitis, that's usually a steroid. But can we make the list of all the consequences of long term use with steroids? Like, we will be here all day long.
We don't have time. We don't have time for that.
Absolutely. So if a patient can maybe just use a steroid when there's an acute flare, and then for the management between those flares, there could be dietary approaches. Okay. Anti-inflammatory diets. Yes, because there's research that shows certain foods can affect like IL-6, TNF alpha, which are the inflammatory pathways that lead to conditions like psoriasis. Can we use those too complementary so we don't have to give you as much medications? And also something that doesn't get, I feel, talked about enough why we're so looking for these complementary approaches is that for certain conditions, there's not a large pool of medications that work. It's something we don't like talking about. So you're always gauging how much and how often do I give this medication, knowing that it's the one or two of the only proven treatments for it versus what is your lifespan? How do I balance those two so you have enough? You don't get to a point where your body has built tolerance and no longer responds to those are some of the conditions that doctors think about every day that keeps us up at night that we don't talk about. So I see things like working on stress management, behavioral management, diet, along with medications to be beneficial in having better medication stewardship, especially if it's a certain kinds of medications. But as far as inflammation, omega 3 specifically, because there's omega 3, 6, and 9, omega 3 has been shown to impact inflammatory pathways. So now the onus is on the public to understand okay, what is the best source of omega 3? Because we want it to come from food so that way it's bioavailable in the body rather than a supplement, which we know with the formulation, you might not actually be getting what's labeled on the container. So, there is a place for medications, but probably a change in how much we use and the way that we use it.
Yeah, and I think it's important to know that, it's not a magic pill, right? And you still have to do the work yourself to exercise, to eat that healthful diet, and that even taking these medicines, you can't it's not just a magic pill that you can still keep all your bad habits, right? Like we haven't evolved to that. I would love to know if you could just dive in just a little bit further on an anti-inflammatory diet, because I do feel like I hear that a lot. I personally tell my patients, like, eat the rainbow, right? And I tell my children, honestly, I'm like, if your plate looks all beige, right, we have a problem. Let's have some color on the plate, like with different fruits and vegetables and protein and things like that. So, how do someone ask you, what kind of diet should I eat to prevent inflammation?
That's a challenging question. Right now, what we're finding in the research is that there has been a few instances where an anti-inflammatory diet has been quote unquote prescribed to a patient, but the challenge is that this field of nutritional dermatology is in its infancy. So the use of the diet, the frequency, the consistency across different studies, that's not yet there. Having a large rigorous study, the kind that we like in medicine, to be able to draw definitive conclusions, that's not exactly there because the way that it has been implemented has not been consistent across the board. But from the studies that have been published, and something that's really interesting about that, when I did my last literature review research on that, the studies that have been published have been within the last 5 years. I first cast a net for 20 years. I know I was gonna do 10 just to see, and, there was maybe one in 2015, one back in the '90s that kinda brought up this topic, but the most published studies were the last 5 years. So, that kinda tells you a whole lot. Um, but we can see things like, for instance, anti-inflammatory. We know that's gonna break down proteins. We have that chronic inflammation of the body. Um, Collagen is a protein, so that gets broken down. So patients always want to rebuild that, and all we hear is like, "You're aging, your collagen's gone, you're sagging." That's all you hear. So everyone always comes in with the collagen. So you hear, okay, maybe have a supplement with collagen or eat foods that are going to increase collagen. But what's really missing is that before your body really builds collagen, it needs vitamin C. You don't hear that in the discussion a whole lot. Like vitamin C is going to help build the collagen. So in addition to that, you also need vitamin C rich food. So if people are like, I grab me a bag of oranges on my way home. I'm like, okay. So that's just one example. So vitamin C, you're going to need that in addition to the collagen sources. Proteins, there's been so many studies that show that the adult population really struggles with protein intake. Okay, your body's not producing that as efficiently. With inflammation, you're also breaking down what protein you have a lot faster. So we need to increase our consumption of that. And that's one of the nutrients that we're deficient in. So when it comes to anti-inflammatory diets, we kind of grab onto that word there, but it's really having this balanced nutrition that reduces the effects of inflammation and also builds up what, unfortunately, as we're aging, our body doesn't make efficiently as it used to.
Yeah, and of course, like minimizing processed foods, right? Like that's a huge promoter of aging, inflammation, foods with high glycemic index, all of that. So yeah, and I loved how earlier you alluded like the skin gut brain connection. Like it's all connected. So what you eat, things you put into your body, it is gonna be reflected in your skin. So great pointers there for a healthful diet. Now, I want to kind of wrap this up, but I want to know about this Radiance protocol that you have and what it is exactly and who it's for.
So I've been in this work for probably 18 years now, and there's lots of signs coming out. You just read it all, it's just information. So I really want to create a system to help people take all of this great science that we're learning and start to build it into their lifestyle. So with Radiance Protocol, what I focus on is teaching the science that we're talking about right now, but how to use it, how to immediately implement it. What are some systems, some changes that you can start making today to bring this science into your skin health and your overall wellness regimen? So it's the science, but it's also the how to. We've talked a lot about food. So, okay, am I going to eat this collagen, eat this for vitamin C, eat this for protein? We have actual recipes that are built around all of this scientific research that we're talking about and how anti inflammatory diets affect skin health. We also focus on the other very important paradigms that you have to fit together because, as you've seen from our talk, we've kind of been in different domains of wellness because it all has to come together. This is a lot for a person to put together. When I was a health coach, especially when I worked with the high performance individuals, my job was to make sure that as their roles, their jobs, they're in different countries, they're flying, they're doing premieres, that we're adjusting their lifestyle, their diet, their exercise, their stress management, so that way they can continue looking their best. So with people without the glam team,
The regular folks.
how do I get all of this great science into my everyday? And so that's what the Radiance protocol was all about, making that available to everyone.
Yeah, it's so important, right? I mean, that's also why I started this podcast and this channel is I know there are not enough dermatologists out there, and we don't have time in the insurance model to really sit down and delve into these topics. So, this is like free information for people to gather that information as a substitute, right? To sort of help people along because I know that is a flaw in our system right now. So I love that. And where can people find it? Where can they follow you if they want to learn more? What's the best place for them to do that?
Sure, you can find it at Radiance Protocol, where you can actually sign up for a free masterclass and what we're discussing. And that would be the best place to find me and follow me.
Amazing. Well, I will definitely include that in the show notes. And I love having you on. I've learned a ton. Thank you so much, Dr. Ori.
Thank you, Dr. Mina. This is a wonderful platform that you built.
So we'll see everyone next week.